Hello! Today I found a really great video on new immigrants and the health inequities they face when migrating to Canada, such as inaccessibility to services, unemployment, etc. So, while I order food, I think you guys should check it out. Here it goes.
Today we will be talking about a very important issue Toronto has been experiencing. One identified priority health issue is the lack of awareness to access resources when new immigrants come to Canada. We have many guest speakers coming in to speak with us about this issue today. We also have new immigrants sharing his experience as a new immigrant when he came to Canada. Let's welcome our guest speakers to the show. Welcome. Okay, why don't we have a seat? Okay, great. Why don't you guys introduce yourselves?
So hi, my name's Cammy. I'm a community health nurse from Toronto Public Health.
Hi, I'm Daryl. I'm a social worker.
Hello, I'm Denver, and I'm also a community health nurse from Toronto Public Health.
Thank you all for joining us. As you know, Toronto is a very multicultural community and is always welcoming newcomers. However, there is an issue that many new immigrants do not know where to access resources. Cammy, can you tell us more about this issue?
Well, yeah, after conducting the community assessment, I have found many different factors which resulted in these issues. So some factors include knowledge gaps, cultural differences, lack of income, and poor support networks.
I agree. Being an immigrant myself, I understand it must be hard for new immigrants to adapt to the new lifestyle. Can you tell me more about cultural differences?
Yeah, cultural differences is a huge factor because in different political and social systems in their countries of origin, some immigrants have different difficulties adapting to the consumer model of healthcare in North America, which incorporates the concepts of individual responsibility, autonomy, and choice. So they have low motivation to attend health education and assume self-care responsibility. Immigrants often result in dominant Western biomedical model because of different cultural beliefs and traditional health practices. Some immigrants come from countries where there are elaborate systems of traditional medicine and beliefs about health and disease which may not be accessible in North America, which results in these issues as well.
Also, many immigrants that come to Canada do not speak English, so it's difficult for these individuals to access resources. Other barriers to services for immigrants are related to organizational problems in delivery, cultural incompatibility, personal attitudes, and circumstantial challenges. Healthcare professionals do not speak the various languages spoken by immigrants, making it difficult to understand their needs and concerns.
That is a very good point. If healthcare professionals cannot identify the concerns of new immigrants, it is difficult for them to provide care.
Also, another issue is new immigrants experience the lack of basic knowledge and skills to navigate Western healthcare systems. So many have difficulties making appointments, understanding the needs to disclose personal information, knowing various healthcare givers in a healthcare team and discussing their concerns with healthcare providers. And some immigrant groups have low level of biomedical knowledge and health maintenance concepts.
Also, I just want to add another issue is that this disadvantaged socioeconomic status. Immigrants often experience decrease of socioeconomic status in the new country because of unemployment, reduced income, and unrecognized qualifications.
I completely agree with you, Daryl. For example, some people who complete their schooling in countries such as China and Japan may not have their degrees or their certificates recognized in Ontario due to provincial policies. They come here being promised employment and will have to complete another few extra years of schooling. This contributes to the stress of living in a foreign country. Another thing with that is, even if they complete schooling, some may not even be able to find jobs in Canada. Ever heard of brain waste? It is a term that describes the wealth and knowledge gained from international students that are not able to integrate their expertise in Canada healthcare system. In other words, international students who come to Canada with a huge amount of human capital, which is the strong potential of the students to sustain or improve the healthcare system, is wasted due to unemployment.
I see. It is very hard for immigrants who come and experience all these factors. Now I'm going to show a live interview with a recent immigrant about his experience when he first came to Toronto.
当我第一次到加拿大的时候，一切都觉得很新鲜。然后我来这里是因为为了给孩子更好的教育，所以到这边。我最早的时候去工厂做现金工，因为那时候还没有打工卡，所以而且我很庆幸那时候没有生病，因为我还没有健康卡。我所周围的一切都是英文的，所以需要一段时间去适应。而且我想政府应该提供一些交通的服务，因为才来的时候我们需要去办我们的身份证件，像是工卡或者是健康卡。
Thanks for sharing, Andrew. I can tell there are a lot of knowledge gaps as to where to access resources. Daryl, can you tell me about some of the services offered around the community for new immigrants?
Well, actually, there are many services offered for the new immigrants, which can be accessed from the internet. The YMC offers newcomer settlement programs, including language assessment and referral centers for ESL classes. They also provide information for employment, education, and obtaining health cards.
Okay, thanks for sharing. Now we will have a guest speaker from Center for Information and Community Services, or CICS, to speak to us about the services they offer to the community. Let's welcome Kathleen. I understand CICS is an organization funded by United Way which provides services to immigrants.
Yes, actually this services is also funded by the Ministry of Ontario, City of Toronto, and Immigration Canada. The CICS is committed to providing clients with equal access to services that meet their individual needs. So they're there to empower the immigrants as contributing members of Canadian society. Also, they provided linkages to community resources.
What are some of the services offered from CICS?
Yeah, CICS offers a variety of services for immigrations for all ages. This organization provides information for employment opportunities, education, and daycare centers. It also offers settlement services such as linking new immigrants to applying for health cards, social insurance, number cards, and Canadian citizenship.
Thank you for your input, Kathleen. This is really useful information. Now, where can immigrants access your information?
Yeah, that's a good question, Chelsea. We currently have 6 offices scattered around Toronto. We offered services in many different languages, including Chinese, Tagalog, Punjabi, and Tamil.
Thank you very much, Kathleen. And again, all of the information will be posted on our website. So, there are many resources around the community, but it is difficult for immigrants to know where it is located. Let's discuss some strategies that can be implemented to increase awareness of resources.
Well, one main thing is that translation and interpretation are necessary to improve access to health information. So literal translations may not be effective at communicating complex health concepts and motivating behavior change among diverse immigrant groups. So the translation of health-related pamphlets from English into a target language may deconceptualize the meaning because cultural concepts are not necessarily included by the translation itself.
The public health nurse should mobilize the existing community resources, link the newcomers to these resources with language courses, such as ESL, link courses, social housing, and other government-sponsored benefit. And programs as some new immigrants may be reluctant to be involved in the community due to lack of trust, to new environment, especially those without permanent resident relatives, which would decrease culture shock and encourage integration into society.
Actually, nursing, medicine, public health, psychology, and community health are the most dominant disciplines addressing immigrant health education.
Yeah, active community participation is essential to health education targeting immigrant populations. But knowing that these resources are available, one thing to be cautious about is how multidisciplinary healthcare professionals compose themselves in regards to the care they provide. Although this is all very helpful and these resources are great, we should not be in the position where immigrants or people in general feel as though they are patronized or judged based on their cultural beliefs and practices at home.
Thank you all for joining us today. We have definitely identified some very useful solutions that can be implemented. By working together, we can increase awareness and continue to offer support to help immigrants find resources when they arrive in Toronto.
Western culture never tasted so gross. Pretty good video, eh? Love the people in it, especially this guy.
The YMC offers newcomer settlement programs.
But on a more serious note, due to the increase of people migrating to Canada, bringing along the wealth of their expertise and knowledge of their own professions, do you think Canada should change its laws and or policies to extend the recognition of foreign credentials? Why or why not? Please send your wonderful thoughts on Moodle. Thank you, and have a good day.